Hello, I'm Dr. Rhonda Johnson. Today is Sunday, June 9th, 2024, and today I'm doing a COVID update. Here's my update for the month of June. Well, according to the CDC COVID data tracker website, the KP variants, KP.1, .2, and .3 combined make up 55% of the current COVID variants infecting people in the United States, although some regions no longer report COVID data. Now, these variants are called the FLIRT or the flip variants. And if you are still following COVID variants, I know many people aren't, they are the ones that start with KP or JN. Now, according to the Johns Hopkins School of Public Health website, I want to do this as a quote. It said, when it comes to symptoms, we're not seeing anything new or different with these variants. We continue to see more mild disease, but that's likely not because the virus is milder, but because our immunity is so much stronger now. After years of vaccinations and infections, most of the population is better able to fight off infection without as much concern for severe disease. End of quote from the website. Now, I do, however, want to exercise a word of caution. Remember, folks, that the elderly, 85 and up, people who are immunocompromised, and those with multiple secondary medical conditions remain the ones most at high risk for COVID complications. Now, according to the CDC COVID data tracker website, emergency department visits that were diagnosed as COVID in the past week were up 16.2%. Hospitalization and deaths remain unchanged. So, moving on. Next, I want to do an update on the next COVID vaccine. Well, the FDA's Vaccine and Related Biological Products Advisory Committee, that's the panel of experts, met on June 5th to discuss, and they made recommendations on the selection of a 2024-2025 formula for the COVID vaccines for use in the United States beginning in the fall of 2024. This FDA expert committee unanimously voted to recommend a monovalent JN.1 vaccine lineage composition. So translation, folks, there's going to be a new COVID vaccine this fall, and it's going to be the JN.1 lineage. So what comes next? Well, the all three COVID vaccine manufacturers in the U.S., that's Pfizer, Moderna, and Novavax, are already working on a JN.1 updated COVID vaccine. They have been testing these vaccines on mice and monkeys. My understanding is that this updated vaccine change will only involve a few amino acids. I don't believe, folks, that there will be any human trials, but I'm not 100% certain on that. This seems to follow what they've done in the past. So my understanding is after the updated vaccines are approved by the FDA, the next step is the CDC Advisory Committee of Experts will then provide guidance on who should get the updated vaccine, and then the CDC director will make a decision, and then in the fall, you'll be able to get those vaccines. Now, I'm told that the insurance coverage might not be the same, meaning there might not be an option for uninsured people. But again, we'll have to see. So that's my message for COVID for the month of June. Unless something else comes up, I hope you'll stay safe. I hope you'll be well. And until next time, take care, folks.